I'm Julie Mason. You're listening to Sirius XM. Thank you so much for joining me. You may know about the Heritage Foundation, conservative think tank here in Washington, D.C., dealing with public policy and other issues. Maybe you don't know that they have a coronavirus task force. Joining me now, Dr. Charmaine Yoest is co-executive director of the National Heritage Foundation Coronavirus Recovery Plan and vice president of the Institute for Family, Community, and Opportunity at the Heritage Foundation. She tweets at Charmaine Yoest. Dr. Yoest, welcome. Jackson, is she with me? Oh, Dr. Yoest, are you there? Oh my. Some phone troubles. We should try her back. The Heritage Foundation is talking about, and I have so many questions about this, all of society approach to obviously concerned with bringing back the economy, but in a sane way, recognizing that decisions to reopen the American economy must proceed expeditiously, and our recovery over the months to come cannot follow a national or top-down approach. You know, the White House was warning about this today, about the I'm looking for it. It was not about the uptick in infections, but about the terrible state of the economy. Basically saying it's so bad, it's worse than you know, and it's not going to get any better. All right. Dr. Yoest, are you there?
Hey, Julie. Thanks for having me.
Hi, of course. Thanks for joining me. So I'm curious about all of society approach. Tell us about the plan.
Well, we've said from the very beginning that, one of the most important things is that when you have a novel virus like this that we didn't have as much information about, that you needed to have local people making decisions at the level that's closest to the people. This thing had a different effect across the country in different populations and also in different places. And so even now, as we move deeper into recovery, people really need to stay in touch with what's going on in their own communities as they make their decisions.
I think that's a really, really good point. Wherever you go, it's different. I've heard from listeners who've been, driving around the country that it's just different in different places.
Well, I think that people get really nervous when they look at the data and they see such large numbers. But when you start breaking it down and you see over half of the cases occurring in nursing homes, for example, why would you be making decisions about a virus that has been really, really bad for nursing homes in New York City versus, and then make a decision for playgrounds in Montana based on that? It's a very different scenario. And now that we are better equipped with information, for example, we didn't know that this was a virus that particularly attacks people over 65 with comorbidities. So now that we do know that, you want to really focus in on the people who are most vulnerable. And that is actually the right thing to do, because if you have a one-size-fits-all, that makes it a more diffuse attention. And you're not going to get as much attention as you need to the people who are living in nursing homes or other places where there's more density.
I noticed that your plan includes slowing the spread while expanding testing, reporting, and contact tracing. That's been tough for the federal government or for local governments to get off the launching pad.
Well, I think there's going to be a time and a place where we do an after action and we look back and we say, hey, what happened there? We already know, for example, that the Centers for Disease Control ran into real problems with bureaucratic issues and some other things, too much regulation. So we've addressed some of that, and frankly, in typical American fashion, we've ramped up really dramatically in testing. So I think we're doing much, much better, but it was rocky there for a little while.
There was a quote from the White House that I was looking at earlier while you were having phone trouble, and I found it. I wanted to come back to it because I think it's so important. This is Kevin Hassett, who is a White House economic advisor. He said, I think everyone should be worried about how this is going to turn out in the end because it's a shock unlike anything we've ever seen. He was talking about the economy.
Well, exactly. And I think one of the things that we've learned is the one size fits all and this idea that we all stayed home really ended up having some unintended consequences that were pretty brutal. For example, now we're looking at 30-some million people unemployed. 1 million of those at one point was in the healthcare sector. And that's just really, really not the result that we wanted to see. By locking down the healthcare system and saying that we were only going to focus on coronavirus meant that people who have been listening to public service announcements for years saying if you've got these symptoms for, heart attack or stroke, go immediately to the emergency room. Suddenly, they were afraid to go to the emergency room. They weren't able to get their normal health care. And as a result, we've seen an increase in people dying at home when, maybe they should have been getting the health care that we're used to providing. The truth of the matter is that the American healthcare system turned out to be more robust than our worst fears led us to be concerned about. We have been able to respond and to take care of the people who needed the care.
At the same time, if I got sick, I would not want to go to the hospital. I mean, it just seems dicey, doesn't it?
Well, here's the thing, though, Julie. I don't know. I can't make a judgment about your healthcare situation, but for some people who are on a bubble or who have some pre-existing conditions, that might not be the best message for them because there are a lot of kind of ordinary, everyday tests and treatments and surveillance kinds of healthcare that if people don't get them, it really doesn't end well. And that's what the healthcare industry now is turning around and looking and saying, we need to back off of this idea that we're only going to focus on the coronavirus.
Yes, in fact, and I'm sure this is true of a lot of my listeners, I've been hearing from my insurance provider and my GP saying like, hey, healthcare is still happening. You can get what you need. Come in, see us if you have some needs. Like if you need to see the doctor, we're open.
Well, and that goes back to the whole idea of kind of a stratification of risk and focusing on the people that we know are most at risk. And as we've gotten deeper into this, and now that we didn't know that 2 months ago, but now we do. And so I think that we've got that, we're empowered now to feel much more confident. For example, there was a time when people were concerned about even being outside. And now what we're looking at, we're saying the best advice that we're hearing from the experts that we're working with is that you do need to wear a mask, but you don't need to necessarily wear it when you're out jogging, for example. And outdoors, the transmission is not as much of a problem. But, if you're going to be in a situation where there's crowds and people more closely together, it makes sense to wear it, for example, to the grocery store.
My guest, Dr. Charmaine Yoest, is co-executive director of the National Heritage Foundation Coronavirus Recovery Plan. She's also vice president of the Institute for Family, Community, and Opportunity at the Heritage Foundation. She tweets at Charmaine Yoest. Your plan for reopening also includes establish U.S. leadership in economic recovery. Of course, we just got the news today that the EU might not be allowing Americans to enter and things like that. There could be like some real global repercussions or consequences for the U.S. handling of coronavirus. I wonder how that would impact the economy.
Well, there's a couple of things there. For example, just the fact that the world is a much smaller place and the kind of travel that people are used to now, we've got to have real partnerships and cooperation around the globe as we look at tracking this virus and making sure that it doesn't continue going across national boundaries because, viruses don't care, right? But frankly, and in terms of emphasizing international cooperation, let's be honest, part of the challenge that we're having here was the lack of transparency that we had from the Chinese government from the very start. We offered to send teams from the CDC over to study it, and they rejected us. And that's the kind of thing that, again, going to when we get to an after action and perspective, they've got to be held accountable for being more transparent and having cut the information flow across governments, it's absolutely essential in these kinds of pandemics.
Phase 5 of your plan includes reduce future risks of pandemics. We've been warned throughout that this isn't a one-off.
Right, absolutely. Pandemics happen. That's the bottom line. And because the world is a smaller place, there in some ways there is a greater threat now because we all do travel so much. It's much easier for a virus to travel around the globe than it used to be. So we have to be better ready. And frankly, part of the challenge, again, going back to the fact that this was a novel virus, is each time you don't know whether what particular capacity you're going to have to ramp up. So even at the beginning, we thought that we were going to need a lot of ventilators, and now it looks like the medicine is taking us in a different direction. So we're going to have to emphasize communication, coordination, flexibility, and rapid response. And we get into this in the 5th chapter quite a bit in terms of it's very difficult to plan ahead because you can't preset a lot of these things, but you can put in place flexible and nimble and systems that are able to be better responsive than what we've seen this time around.
So what are you doing with your recommendations, Dr. Yoest? You come up with a list of things that should be done, and where does it go?
Well, we would love to hear from your listeners, and they can very easily access the report at coronaviruscommission.com. There's a place there where you can leave us your comments. We'd love to hear from you. We'd also appreciate your help in distributing the report. You can download it right there from the website. And there's actually a set of kind of bonus extra 15 recommendations for individuals. The report itself was designed to go to policymakers, but we think that there's actually applicability for individuals as well.
Charmaine Yoest, Co-Executive Director of the National Heritage Foundation Coronavirus Recovery Plan. She tweets at Charmaine Yoest. Thank you so much. Great to talk to you.
Thank you, Julie. Great to be with you.
Take care. All right. So the Conservative Heritage Foundation has come up with a policy plan for bringing the economy back. It does sound, according to what Kevin Hassett says, although he sounds so much like Trump, doesn't he? It's a shock unlike anything we've ever seen. That's such a Trumpian construct.